Hi everyone, I'm Christy Dominy. I'm a certified trainer in Georgia. I've been a certified trainer since the beginning of 2012. And today we're going to go over a few things that have to do with emergency preparedness. The first thing that I would like to show you is on the website, and that is your offline forms. These are forms that you can print off if you need to have a backup copy of something in the homes, if the region that you live in is prone to power outages or the internet going down, offline forms are a good way to have a backup in the houses. So if you'll type in the search bar offline forms, it'll give you this Therap offline forms. And it'll give you a large listing of all of the forms that you can print off so that you have backup copies. Like in health tracking, you can print off a seizure tracking record or vital signs if you need to have a backup. The general event reports are really handy. So if there was an event that happened and the staff didn't have access to a computer, they could jot it down real quick and then add that information in later. There's also a lot of state-specific forms. So if you live in any of these states, you can click on them, like Florida. That has their specific incident report form and their med error forms. So you can look through these in your own time. One suggestion about the MAR form. The MAR form online has all the meds on it, but if you print the offline form, it's just going to be a blank form for you to write in the meds. And if the person only has 1 or 2 meds, that's maybe fine just to use the blank form. But if you want all the meds to show up on there, it might be better to print one off of the MAR within Therap, so you get all that person's information carried over onto the form. Okay, now I'm going to go into Therap. Let's see if I can make this bigger so y'all can see. Okay. The first thing I want to show you is your IDF form, and I know many of you already know about your individual data. That's the first information that you put into Therap when you start. But there may be some things about the IDF form that you might not have thought about. I'm going to look up Tinkerbell's. So the first thing is their photo at the top. You want to make sure that you keep these photos current, because even if the person doesn't have a MAR, which the picture shows up on the MAR form, but if the person doesn't have a MAR, you can still use this photo in case of emergencies. If you're at an event somewhere and the person that you're supporting gets lost, you can pull up that picture off the website on your phone and show authorities so they can help you look for the person. That has all of their identifying information, which will carry over to your emergency data form. The emergency data form you could use for putting in emergency go bags, or if you have a specific set of rules that you follow or guidelines about evacuation and what you need to take out, you can use this form to put in that, so you will have the person's emergency contact information. It also has their diagnosis. The emergency data form doesn't carry over a list of their medications, so you would need to print out a list of their medications if you wanted that with their emergency evacuation supplies. I'm going to scroll down to where the contacts are. Typically right here is where you put family members, advocates, that sort of thing. I would suggest that you could add fire department, police department, any kind of emergency personnel that the person might need to call. I know we all call 911 when something major happens, but maybe there's an animal in their yard and they need to call animal control. So you could add that onto here. It's just a handy place to put general emergency contact information. Under their shared contacts, usually we put, of course, their physician in here. You could also put some of your staff, if you have a behavior specialist on staff that is maybe part of a crisis team, you could add their information in here, and this populates from shared contacts. So in order for you to add these here, it would have to be listed under your shared contacts. The reason that we prefer to put the behavior specialist under the shared contacts is because that person applies to a lot of people that we support, and we would use him as a shared contact for many people. If you have an urgent care in town that the person may need to call in case of emergency and they're not going to go see their regular doctor, you could add that here. Their pharmacy, I know typically people don't think about adding pharmacy contacts, but if you're evacuating and you need refills for the person's meds, you might need that pharmacy contact. Your support coordinator, dentists, other physicians, and if you have a person that receives services from other providers, you might want to list those other providers just in case something was to happen and you need to notify them that the person has been hospitalized or that sort of thing. It also has a great deal of information about their insurance and what kind of behaviors they have. At the bottom, there's a place for you to attach files. We've started uploading things like their emergency evacuation plan, the little drawing in their house that has the routes that they should follow when they evacuate. This is a continuing operations plan that's been uploaded. Anything that has to do with emergencies that's specific to that person, you can upload here with all the other stuff that you're adding. Okay. Let me see, was there anything else? On your emergency data form, it's basically the same information except it doesn't carry over items that you wouldn't want everyone to have access to, such as a person's social security number and that sort of thing. This form is not where you can go in and edit things. You have to edit it on the individual data form, but you can set your privileges inside of Therap so that when you update something on your individual data form, it will send a message out to the direct support staff that they need to print a new emergency data form for their go bags or their books that are in the homes. So they'll have the most current one available. Whenever diagnoses get updated, it automatically will send a new EDF out to that staff for them to print. Okay, the next thing I was going to talk about was your Ipops. Your Ipop is your individual plan of oversight and protection. We use the general one because it has the most information, but it's not really specific to each one of the different services that they get. You can use any of these that fit your needs. I'm going to show you the general information one. So I'm going to click on 21 Jump Street, Tinkerbell. So the Ipop gives you a lot of information that might be important to have if you have new staff coming on and they don't know how a person would respond to certain emergencies. So if the person has adaptive equipment for communication, you might need to know that, that the person prefers not to use their iPad or whatever device that they use to communicate during an emergency because they're stressed. And you could put information like that in here. Their med allergies is very important, food allergies. Can the person apply simple first aid or identify their need for first aid? So if a person gets hurt, can they, do they know to cover the wound and not pull the bandage back off? So this might be important information that the staff need to know and to have on hand in case of emergency. How does the person respond to pain? And then you can go into specific protocols for the person. So if the person has diabetes, you might have a protocol that says if it reaches a certain level that you need to call their physician or you need to call 911, and you could list this here. So it's kind of like a healthcare protocol with your seizures, your high blood pressure, and then other stuff that doesn't fall under that, you can add right here under your nursing service and protocol. If there's specific instructions to the staff, just to let them know, hey, this person is prone to unbuckling their seatbelt while you're going down the road. You could add general information like that into here. It has a listing for all of their adaptive equipment that they may have. Staffing requirements for medical dental appointments. Sometimes individuals require 2-to-1 staffing when they go to doctor's visits because of behavior needs. And it goes into their level of self-medication. What kind of assistance do they need? Do they have to have food or drink with their medications? If a person requires peanut butter in order to take their medication, you might want to list it here, because if you evacuate and you don't have that peanut butter, you're going to run into some issues. The next page has nutrition guidelines, what adaptive equipment they'll need. So if you're evacuating, you would need to know that this person has a special spoon that they eat with, or other kinds of utensils. You may have people that have a behavior plan that says they're not allowed to have forks or knives. So you may indicate in here, this person's not allowed to have that sort of thing. So when they evacuate, you'll know not to go by and purchase that for their go bag. The individual's ability to plan and choose and prepare their own meals, how they take care of their dental care, their behavior needs, and other significant information. The individual's rights. Are they aware of their rights and can they protect themselves? And the individual, do they have a health care proxy? So you can list all the proxy health care people that's listed on their plan. And you can attach other files down here if you have other forms that's sort of related to this area. I know Delmarva has a self-preservation tool, and CARF and CQL have their own health and safety related assessments. You can add copies of those here. And when you create an Ipop, it sends it out to all the staff, puts it on their to-do list to acknowledge. So they'll be acknowledging that they've read all this and they understand it. And you can also have a copy of it in the home in case there was an emergency. Under the Global Template Library, there are many, many different kinds of emergency drills. If you want to look up a fire drill, there's 15 different fire drills in here. and you can go through all of them and see what you like, what you don't like. You can create your own template if you would like to, but sometimes it's just easier and you get good ideas from other providers on what you need in a good form. I'm not going to click on mine because there's some spelling issues with mine. Let's look at this fire drill report. So this one goes through and asks questions: were all the people safely evacuated? Was the area identified as a simulated fire location? So all the basic things that you would need to record. If you find a form that you would like and you want to import it to use, you would just go to the bottom and click import as draft. And then you agree that you're not going to use it for your own private use. Once you've imported it, it'll show up in your own ISP program template library as a draft. So you go to your drafts, and here it is at the top. So now I can go into it and actually make any changes that I would like. If there was a question on it that that I didn't want, I could take it off. If there's something missing, I can add to it. And once I have it just the way that I want to, I can approve it. Once it's approved, it'll show up in your template library. Right here, your ISP program template library, under your published. Then you can click on it and you can apply it to any individual that is within your system. So I'm going to take this template and apply it to Tinkerbell. So I'm going to click on apply to ISP program and the program that she's in. And then I'm going to name it whatever, you know, if you want to name it fire drill or monthly drill, and then the date that you want it to start. And again, if you want to add specific items to it that's specific to that person or how they evacuate, you can change the form and update it at this stage as well. So I'm going to hit approve, and that's going to make ISP data for Tinkerbell that the staff can go in and record their fire drills. There's also severe weather drills inside the global template library. Let's see what else is in here. There's a severe weather drill for a winter storm. And that one is a severe weather drill. I don't know if anyone has done an earthquake drill. No. So any of y'all creative people out there, make us an earthquake drill and upload it to the global template library so we can get ready for that. Let's see, power, maybe there's a power outage. No, there's a wheelchair inspection though. Another area that you could use to maybe look at risk management for emergencies is your event summaries. So if I wanted to look at Tinkerbell for the past 3 months, because I'm concerned with her health or something's been going on with her, and I want to come up with a good plan to support her, let's do monthly. So I want to see all of her incident reports for the past few months. So she had 1 in May, none in June, and 1 in July and August. I can also click by program, and I can see that she's had 2 incidents while she was at 21 Jump Street, but only 1 incident at the Certified Trainer program. I can look at it by type, and I could see that she's had 1 injury and 2 med errors. So some of the issues she's been having with her health might come from her actually not getting her medications on time. So you can use the data within the system to generate lots of plans and supports around emergency preparedness, as well as risk management. You can also pull data from the fire drills and severe weather drills that you're using. You can do, they have reports. I don't know if there's anything in the system. I'll just select all of it because I don't know. So if I wanted just to look at a HAB documentation record, whoops, don't hit the back button. And I want to see July. It would show me all, if she had completed her fire drill, it would have pluses or minuses or whatever scoring code that you selected for it, and the staff's initials that she had completed each one of the tasks on that ISP data. So you could track how many times in that month that she did each one of those. You could also tie this into the new business intelligence system that has just come out, and you could tie it to, say, like a to health and safety, and you could generate reports from that to see how much in compliance everyone was with getting their fire drills done every month. Okay, I think that is all I had. Johanna, if you want to open it up to any kind of questions that anyone might have.
I do see some questions in the chat box. I don't know if you can you see them or not?
Hold on. No, I can't see them.
So somebody asked, can you show us how to apply a fire drill to an individual? Did you?
Okay.
And this says this would be applied per person, not for a house, correct?
Correct. It's per person, and it makes it more person-centered to apply it per person, because there's never any 2 people that evacuate exactly the same. So you would want to do a report for each person in the house that was evacuating. But let me go back. So I showed y'all how to import it from your global template library, and it'll go into your drafts. Then once you've made any changes to it in your drafts, it goes into your published. To apply it to someone, you pull it out of your published library, not the global template library, but your own library. And then down at the bottom, it has apply to ISP program. And then you'll select whatever home or service that they're getting and the person's name. You do have to do it 1 person at the time. You can't just apply it to everyone at one time. So if you wanted everyone's drills to be named the same thing, that's okay, but you can't apply 2 programs to Tinkerbell, both of them named monthly drill. It's not going to allow you to do that. Okay, did that answer the question about how to apply it to a person?
Did that help you guys? And then, even though this is GoToWebinar and you guys are muted, if you have questions, we should be able to unmute you if you have a question. Plus, I can look and see the questions in the chat box. So I'm looking to see And somebody asked what time it is in Manila. It is like 1:41 a.m. um, but I know this was such a popular topic, and I'm sorry about the delay in getting things started, y'all. So I'm looking through to see that. I think that's most of the questions. Does anybody else have any other questions? Here we go. What tab is the Ipop feature under? So Christy, do you use the Ipops?
Yes, ma'am.
Can you?
It's under your individual tab. Let me go back to the dashboard.
And that's a custom form, so you have to pull it in.
Right.
And is that something you're familiar with, Christy, as how that works?
Now the ones that are under the custom forms are different from these, right?
That's true, because there's different kinds of Ipops. So I think that you have to, that might be one of the ones we have to activate for folks to see the
Right.
Ipops. So
Yeah, because
if you're not
I think we
with them, if you're not familiar with them and you want to use them, you can send something in through the feedback and ask us to activate the Ipops. That's something that some people really don't know about the Ipops.
Yeah, we use the Ipop in place of Delmarva's self-preservation tool, and they accepted that as a good replacement for it because it actually has more data on it than their tool has. So the general information one is a good tool to use. Was there any other questions?
I see a question. I'm not sure if I understand. What is the state requirement for emergency preparedness for documentation in Therap? So that's from Gabriella. I'm not sure what state you are in, and I know that that's different from. It varies from state to state. So, Gabrielle, if you tell us what state you're in, there could be somebody on here that's familiar with that.
And it also could differ based on your accrediting body, because I know CARF has their own set of standards that may be more intensive than the state regulation.
All right, she is in California. And I admit I'm not totally up to speed on what's required in California. The other, Christy brings up a good point. It could vary based on your accreditation body. It also could vary based on the type of service that you're providing as well, because I know in North Carolina it's different rules for different service levels. So I don't know if anybody on here is from California that might can help. And then the other thing is I always refer California people to my coworker Josh Corzentes because he lives in California and is very familiar. And then another person is asking a question about individual specific. I'm looking to see if I can figure out where that is here. Here we go. Here we go. Can we make individual specific offline forms that are fillable like ISP programs? So I'm wondering if I'm understanding that. Like you can print out like a PDF version of an ISP program that's per individual instead of like the blank offline forms. So is that what you're asking?
Probably the best way would be to go into your ISP data and print it from there so that you had your comment boxes instead of, because the ISP program is going to give you, you know, all the information, but it's not going to give you the blank boxes for you to write in. So they might want to use print from ISP data to do that. so that you would have that person's specific goals that you could use. You just have to remember to print new forms out whenever their goals changed.
All right, so let's see here. I'm going through, and bear with me because let me see if I can pop these questions out so I can see this better. There we go. Because they kind of run together. So let's see here. Let's see. So to confirm, to get an Ipop to show, I need to send an email through feedback or in the main page, right? So if you go to you can go to the issue tracker and submit it through my issues, or you can go down to the bottom and click on the feedback and say, can I get Ipops activated for my agency? Now, sometimes for things like that, they might say that the request has to come from a super admin at your agency, just because that's kind of a security thing. But that's something that if you send the request in, they will either, if you're a super admin, they should be able to activate them. If not, they may respond back and say, can you have a super admin send in the request? We have another one that says, did you say that anytime you change an IPAP that staff have to acknowledge that they've read them? We haven't used them, but they look like they could be helpful in individual specific training for staff.
Yes, so every time that you create a new Ipop or you update an Ipop, it's going to show up on their to-do list, and they have to click on it, read through it, and click acknowledge. So there is that acknowledgement that you'll have to back up that the staff have actually looked at it.
All right, then I see we are a day program in Georgia. Is this mandatory for us to put the fire drill data in Therap? So, Christy, I know you're in Georgia.
Yeah, Therap is not mandated in Georgia, so you can continue to put your fire drills on paper. It's just Therap's a good way that you can go through and pull data from those fire drills. So if you wanted to do a search, and you could type in, let's see, the ISP program would be monthly drill, and then you could search for your agency. If all you provided was the day services, then you could see all the drills that were completed for the last month at one time instead of digging through papers.
All right, and then thank you, Becky in California. She says, in California, if you are an ICF provider, you must follow Title 22 federal regulations and the new emergency preparedness rule. There is no requirement to actually document in Therap, but there are documentation requirements. Not sure if this helped to answer the California question. So you have to have some proof of documentation, and you have to follow the Title 22 and the new emergency preparedness rules if you're an ICF provider. And then I want to make sure we got this other question that Faith has. For example, I know you can download a PDF of an ISP program. Alaska requires that documentation be completed within 72 hours of service. So if emergency, then there'd be a risk of not being able to bill. So let us know if we didn't answer that as far as when we were talking about that just a little bit earlier. And then, can fire drills be completed as a program group home versus individuals? So the way that our system is set up and the way that it's individual based, there's not a way to apply a fire drill like to a group home or like to a group. It's going to be per individual. Okay. So I think Gabriella's okay with the California answer. And Faith in Alaska, did Christy answer your question? My agency was hoping that we would be able to create a fillable, typable form for ISP data collection, but it sounds like a no. Like one that has fields you type in and stuff as you're doing it. I don't think that's something that's possible. I think that's what you mean.
Yeah, if you're real tech savvy, you could probably download a PDF and then add some text fields to it if you wanted to have a offline form that just stays stored on your computer. You could do it that way.
Yeah, that could work. Do we have other questions? Did I miss any questions? If I missed one, just kind of type in so I know it pops up, because we actually got a lot of questions. Someone said, where is the form located again? That was Dina. Oh, and then she said she got it. Okay. Just kind of going through to make sure I got all of these. I think we got Enola's. Let's see. It sounds like staff could fill out by hand, and then documents could be scanned and attached to the system later if we had an outage or emergency. Absolutely. And so I've seen places do that a couple of different ways. Sometimes they will keep a paper copy, and when the system comes up, they will put it in the system as if they would have live, and then they might attach a copy of the paper, or they might make a note that says originally completed on paper because the power was out or something like that. And then I've also seen other people just scan in the paper copy and attach it, to something instead of making staff re-enter it. So I've seen it done two ways. So another question is, any suggestion as to where they would be stored, document storage, or could they be attached as ISP data?
If you're using ISP data for billing purposes, are they referring to using ISP data as like an offline form?
I think so.
Yeah. If that's the case, then I would put it back under ISP data, just so you'll have that placeholder for your billing.
It says, yes, we are using billing and for taking all data.
Yeah. So if you use the form offline, I would scan it back to ISP data and put that time frame in there so you can bill from it.
Does that help, Faith? Let's see. It says, yes, but wondering how I can attach scanned document to ISP data. So you would attach it. I don't think you can attach it to the actual piece of data.
I forgot. Yeah, you
Yeah.
have to,
So
under the mobile app, you could, take a picture of it.
yes, you could. If you have the ISP Data mobile app, you could take a picture of it and it would show up then
Yeah,
anywhere in the
that's
system.
how we put a lot of stuff in the system through the mobile app.
And I'm trying to think, if you didn't have the mobile app, or if you're at an agency where for policy reasons you're not going to use mobile apps, what some other options are. You can attach anything to a T-log. So
Right.
you could name a T-log, you could come up with a name for it and attach it there, and you could put like an explanation in there about the power being out or something like that. And if the T-log was, it's under the person's name, then you can do that.
I would still put the time frame under the ISP data, and you could just leave a comment, CT log dated such and such, just to have a reference back to that paper copy.
Yeah, and since I was in QA for so long, I used to always be a little extra cautious about if the power was out and we were doing it electronically, I would keep a file like somewhere in the office of the paper backup copies, because where I am, they very likely might say, well, where is that paper copy?
Right.
So sometimes I would keep the paper, or I would scan it in and make sure it was in a set place with an explanation that was very clear that the reason that it looks like this is late is because the internet was down or the power was out or something like that. And, if it's something like that, they're going to usually understand, sometimes I can remember the power being out for a week one time because of thunderstorms where I was. And so, once the power was back up, we had all that stuff that instead of making staff recreate it all, we just scanned it all in and attached it with explanations. And also, just to kind of mention, I see that you're mentioning that you guys aren't really using the mobile app yet because it's limited, because there are limited options, like we don't have all the modules like SCOMs. So interestingly enough, now that we have updated the SCOM module and moved it to the new interface, if you go in through the browser on your phone, not through the mobile app, but if you go in through like Google or whatever your browser is on your phone, and you go to the SCOMs, now that we have updated that module to the new user interface, it actually works pretty well from your phone. So as we're going through and updating our system, all of the modules that are not on the new interface are going to be updated and moved to the new interface. So back in, I guess it was September, when we updated the GER module, I don't know if you guys have looked at that, but now if you go through the browser on your phone, you can actually read a GER on your phone, you can submit a GER on your phone, and as we update all of these modules to the new interface, we're making them mobile friendly at the same time. So there could be, some modules where there might not be a separate mobile app and you can just go through the browser and use them. And there could be more mobile apps we develop over time as well. But if you haven't looked at some of the modules through the browser on your phone, you might want to look at some of them because they look a lot different. Back before we updated the GER, there were times when I was in QA that I would log in through the browser and try to look at stuff if I was, out and about or something and not near a computer, but it was hard to navigate and hard to see. But now, since we've moved that to the new interface, it's pretty easy to get on your phone and actually go through it and see it. So you may want to, look at it through the browser and see what that looks like. Other questions? You guys had really, really good questions. I want to make sure that I've got them all. And Christy, this was a very popular topic. We had a lot of people express interest in this. And what we'll do is I'll get this recording converted and get it posted. Sometimes it takes a few days to get it posted. It should be out there by next week at the latest. And if anybody else has questions, just let us know. I'm just kind of checking here again. Any closing thoughts, Christy?
No, I just wanted to mention that whenever you are printing out that emergency data form, to make sure you also print a copy of the person's medications, because medications does not show up on that form. And you can get that through here, or you can go to their individual homepage. The individual homepage, of course, has almost everything.
Yeah, I think that's an important thing to point out. Other questions or thoughts from people? I apologize that we started late, and I appreciate everybody joining, and I appreciate Christy doing another webinar for us. She's done some great certified trainer webinars for us, and we always get good feedback. I'm scrolling down to see if there's more questions. I think we might have one. Can you show us the Ipop form for day programs? I cannot access it in Therap. Do you have that one, Christy? Do you guys use it?
We don't use it because we don't, all of our services are community-based, but I can show it to you.
That'd be great.
When you ask them to open up the Ipop module, it opens all of them, so you'll get all of them with it. Okay, so this one has their approved route of travel, any specialized instructions, if that be within visual range or you have to do special checks on them, any specific frequency, supervision to use a restroom. And then this is about going on community outings. What's their approved route of travel for the outings? The same information as above. Any adaptive equipment that they use at the day program, their emergency evacuation from the building, if they can recognize an alarm, if they require special assistance, any behavior concerns, and other safeguards or important information that you'd like to add. And then it has where you can also add attachments to this one as well. So it's not as in-depth as the general one, but it is more specific to a day program.
And that is a good thing to point out. When we activate the Ipops on our end, you get several of them to choose from. And we have another question. Thoughts about, or are there other documents that people maybe should consider printing in case the power is out or the internet's down? Like, does anybody print out recent T-logs or GERs or things like that in case of a power outage? And that's a tough one because you don't really know when you're going to have an issue or when the power's out, and you don't. And the whole point of the electronic documentation is to move away from paper and to keep things more secure by not printing things out. But I know that some places at least make sure that they've printed out that emergency data form so that that's there. And, you know, sometimes the internet or the power might not be out everywhere. So I can think one time where I worked, the power was out in some places for a week, but we did have one or two sites that the power was on, so we were able to go there and access stuff, or we were able to access stuff through our mobile phones as long as the power was out, but as long as we could still get the data through our phones, we could still get to stuff. But sometimes it kind of depends, and some places have more weather issues than others. If that didn't answer your question, let me know, and I'm scrolling down. So people are saying, thank you, it was great. Thank you, Louise in South Carolina. What module is Ipop in? So that's a good question. So Ipop is kind of a module of its own, and it's a module that hasn't really been promoted a whole lot. And I'm not sure everybody knows about the Ipop. We actually had some recent discussions about that. It comes with your basic package. There is no extra fee to use the Ipop. You just have to ask us to activate it. But it comes with what we call Therap Basic. It's just not everybody knows about it. There are certain states that they have to use the Ipop. So from I think what I understand is that those Ipops were developed to meet certain requirements in certain states, but that now other people use them as well because they really are comprehensive and can be really helpful. It's a good place to capture really important information. But it's kind of its own module. And if you look online under our help and support guides, if you type in Ipop, it should come up and give you guides about the Ipop. Does any of the Ipop information populate to any other forms?
No.
No. So that's kind of the disadvantage about it, is it doesn't link to other forms. Yeah, and if a couple people are asking about more information on the Ipop module, look on our help and support site and search Ipop. You can also send in something through, you could probably go on Live Help and they could talk to you about it. And also you can send something through the feedback and say, hey, can you tell me a little bit more about Ipops? And they could send you the link to the guides if you're not able to easily find them on our website. Another question is, would you recommend backup battery packs or mobile hotspots? As far as the power being out.
Yeah, we use both, and we've considered doing the solar powered chargers for like tablets or that sort of thing.
Oh, that's cool. And Takia has a tip that they're using at her agency. They have what they call an emergency Therap binder that has the blank forms in there, and then staff know that if the power's out, they're to put whatever they've done in that binder, and then once the power is back up or the internet's back up, they're required to upload everything immediately once the power's been restored. So I think that's a good tip as well, because some places they might ask you, what is your process for when the power goes out, and how do you make sure you're still capturing everything, and how do you make sure it gets reflected? So, something like, we have this binder with the forms, and then it's our policy that once the power's back up, we scan them all in and upload them. I think that is, would be something that would be helpful if you had something like that in place. Other thoughts or questions? I love that we had so many questions. These are really good questions. Well, I don't see any other questions coming in. So unless anybody's got a last minute question, I'm looking here. I think that we can conclude, and I want to thank everybody for their time. Again, I apologize for the delay in starting, and thanks again, Christy. You always do such a good job on these webinars, and we really appreciate it. One of the things that is really helpful is to have webinars from the provider's perspective. I think that the application of how people are using different modules is just really helpful for all of us to learn from each other, and we appreciate you sharing that with us.
We appreciate you losing sleep over us.
My phone, all these emails were coming through, and I'm like, what is going on? Well, and it's all good, and I hope that everybody has a great afternoon or evening, depending on where you are. And we will get this recorded, the recording converted and posted. It'll probably be one day next week. What we try to do is convert them, and then I send them to the team, and they get them ready, and then they'll post them out there. It'll be in the section that says recorded webinars, and they'll be out there. So thanks you guys so much, and let's see. Yeah, so what happens, there's a question, will it be uploaded to YouTube? So what happens is when, after they convert the recording and put it under the the recorded webinars section on our website, it also is posted to our YouTube channel. I have, in YouTube, there's a way you can go in and subscribe to the channel, and it'll send you like a little update or message when a new video gets posted. So I've done that, so when new videos get posted, I get like a message telling me there's a new webinar. So that's an option, or you can just check it every now and then. But when we post it for the recorded webinars, they're actually going through YouTube. So that should be done. It could be a couple of days, but I usually tell people, give it a week by the time we get everything done. And several people say thank you, Christy. They really appreciate it. So there's several people that have said thank you for this, and thank you for the information and for the great presentation that you did.
All right, thank you.
Yeah, many, many thanks coming in. So thanks to y'all, and thank you, Christy, and everybody have a great day.
Okay.
Bye, y'all.